Hello, welcome to the Hot Dog. As we've seen, COVID-19 pandemic has changed our world completely. We've had good times and bad times, but the most important change is the attention it brought to mental health and well-being. People in the world started to pay more attention to mental illnesses and mental health as more individuals started seeking their treatments and mental health. Even in Kenya, we can tell that there is a lot more attention and recognition for the need of implementing these mental health services. But however, these implementations, as they continue, the common citizen is yet to access nor afford these treatments. So what do? PSI Moi chapter, in collaboration with medical psychology students from Moi University, came up with the group therapy project. The project's intention was to impart basic mental health education to a group of women who at some point in their lives lived in the streets or come from low social economic groups. We reached out to Beruham organization, which was once Oscar Project Center.
My name is Dominic Makori. I'm the program manager for Beruham organization. Beruham is a community-based organization that was registered in 2015, and basically we have our team lead, who is Madam Director. Her name is Yuka Bethowino, who is the founder of this place, and is the vision bearer. Basically what we do, we are serving the street connected children and youths to ensure that they are getting services from our end in terms of those who would want to go back home. We reintegrate and we reunite them with their parents and the relatives who are available. And then for those who would want to be taken to school, what we do, we take them in and we have a transitioning center. So when we are running a transitioning center, we take them through rehabilitation curriculum, and after a while, let's say a month or two, depending with the severity of drug and substance abuse, we now take them back home or we link them to education, depending on which kind of education system, because we have those who again would want to join vocational training centers for them to get knowledge and skills from that end. And at the same time, we have a women group that the street connected mothers and girls, they are coming in to save money for them to start business, and then we equip them with microfinance knowledge, and we take them through how to make a profitable business and to avoid losses. To some extent now they can be able to be self-reliant and to take care of their family and take care of their children. And on Mondays we have the chama for the women and girls from the streets. They come and save money, and as you can see there, they are counting their money to ensure that it has gone to the bank to be deposited in the right way. So once they save the amount of money that they have saved, it is supposed to be deposited the same day, and the receipt is returned to the office. We have a different kind of running programs that we are having, and as you can see, we are farming vegetables, that is sukuma wiki. So to ensure that the people who are supporting us, like Mfalme Millers, they normally give us maize flour, and we now take the vegetables from the farm, at least to cut the cost down and for us to be self-reliant. And at the same time, these are the classes that we normally do the activities in for our women whenever we're having training that they can't sit under the tent. And then when we have like group and individual counseling, it is done from that end. We have street connected children and youths in various categories. And for the street girls and mothers, they are the ones who have been having issues to do with mental health. And we've been partnering with Moi University Beyond Science Initiative program that started with Atia and the team. And currently it is rolling over to the next leadership that we are having, basically to ensure the past experiences and the exposure that women have been having on the streets, they are trying to get out of their past experiences and to cope. So it has been a challenge, and for them to cope, it really needs the session of mental health for them to be talked to, for them to understand how to control all these issues and to cope with them. So, and we really thank the BSI team that has come in, and the way the first lot have gone through the mental health sessions, and they are really doing good. And for our expectation, we would want a place whereby we will have the street girls and mothers now mentoring the others from the street in terms of how to handle the issues to do with psychological and counseling among themselves.
For the group therapy sessions, we had eclectic form of therapies whereby we incorporated CBT, ACT, PCT, and Gestalt therapies, only to mention but a few. This helped us incorporate various techniques that helped us meet the individual's needs and deal with the issues that they had presented. The techniques included empathy, congruence, unconditional positive regard, non-judgmentalism, and even assigning them homework assignments. This helped personalize the treatment and help them conceptualize the ideas that we had taught during the therapy session. Um, uh, for the first three sessions, Dr. Linda Chuma, our clinical psychologist, guided us through the sessions, and we took over for the remaining 9 sessions. And our sessions were semi-structured, which consisted of the initial phase of the session, the middle part, and the final part of the session. After the group therapies, we had individualized therapies, whereby individuals who are not free to open up during the group session, individuals who had scored highly on suicidal ideation on the PHQ-9, as well as those who had scored highly on the CAGE-4 test, were able to talk to us as therapists directly. For the evaluation tools, we had CAGE, PHQ-9, GAD-7, and CAGE tool that helped us assess the mental health and well-being, assess the severity of the symptoms, as well as monitor the outcomes after the 12 sessions.